Here are the equipments: suction machine, suction catheter, paper cup or basin, gloves, sanitizer, distilled water, oral suction wand. Tracheostomy suctioning. When a person coughs, the secretion passes through the airway tube. The tracheous tube can act as obstruction in the airway. The purpose of tracheal suctioning is to clear the airway, remove thick mucus and secretion from the trachea. Hi everyone, my name is Mike Villanueva, and I'm going to demonstrate to you the proper procedure of suctioning, the tracheostomy suctioning. Wash your hands. How are you today, sir? Nice to hear that. For today, I'm going to do suctioning, specifically tracheostomy. Is that okay with you, sir? Thank you, sir. Provide client privacy by closing the windows and put curtains. Prepare all the supplies needed. Put in the bedside. Prepare for the procedure. Keep the suction machine charged. Always keep the AC power cord with the machine. Place the canister in the holder. Canister has a lid. Snap the lid securely into place. Make sure to seal properly. Seal any other open compartment. Connect the suction tube to the machine. Make sure that the clean filter installed in the filter holder. The filter ensures secretion from the canister. Do not get sucked into the machine. There are two ports on the lid. Connect the filter tube to the port labeled vacuum. Connect the long tube to the port labeled patient. Turn the machine on and test for suction. Place your finger over the tube. You feel suction. If you do not feel suction, check the connection. Check for blockage. Check the blockage and connect the tubing firmly to achieve suction. Pour distilled water in the cup. Open the suction tubing. Remove the paper tray to create a clean work area. Do not touch the catheter inside the paper. Using straight catheter, double the glove, your dominant hand with sterile glove. This is the hand that we will use to perform suctioning. Open the glove to the bottom and be careful not to touch the finger. Do not proceed if you contaminate hand catheter. Take the suction catheter out of the sterile tray. If you do not have a medicine cup to distill the water, attach the catheter to the suction hose. Keep your sterile hand above your head. Holding the catheter, do not hold the catheter under your arm. You may be risk contaminating the catheter. Lubricate the tip of the catheter in the distilled water. Now you are ready to sanction the patient. First, turn the machine on. Keep the catheter sterile by grasping around your clean hand. Use your dominant hand to turn the power. Slowly insert the catheter in the trachea tube until you feel resistance. Hold the catheter back to create suction. Hold your thumb over the hole at the other hand end. Allow the person to catch their breath. Rinse the catheter in the distilled water. Repeat the suctioning process. Do this as many times as needed into the air until the airway is clear, until the patient tell you that the tract is clear in obstruction. Wrap the catheter in your sterile hand. Remove the gloves. Remove the tubing and the lid. Do not dispose of the secretion into the sink. This is can clog drains. Dispose of the secretion in the toilet. Clean the canister and lid. Place a clean paper towel. Reassemble the suction machine. Ensure client safety and comfort. Remove the gloves. Wash your hands and proceed to documentation. I will document the time and the date. That ends my video presentation.